tuned to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Partner Show. G.D. Roller and I are talking about healthcare issues, healthcare harm, healthcare situations that we found ourselves in. Also, people that we have interviewed that have found themselves in just heinous situations that they could not believe happened because they weren't forewarned. The informed consent paper. These are all our opinions. The informed consent paper was signed, and therefore it was almost like carte blanche, or maybe it was carte blanche, Jeannie, in your opinion and my opinion, about things that happen after that paper actually gets signed. And you really not have been informed completely of what you should have been informed. And so on that topic, today we are talking about what healthcare providers should not do with patients. So, I mean, that's along the lines of, being informed and who's getting informed and who's not. And why is this such a topic that we have to talk about when it seems like who matters anymore? What matters anymore? And I feel sorry, I've said it a million times, for the people that are in the industry trying to do a good job. And I mean, it's a hard job to begin with, and then when you have to deal with all this stuff. So go ahead, Jeannie. I mean, I don't know that I want to hear it, but we got to hear it.
Okay. Well, always knock and wait for a response before you enter the room. Just don't knock and turn the doorknob and come in as you're knocking. Always know that it's not necessary for a patient to totally undress for every exam. And if they do need to undress, provide them a real gown instead of a paper sheet or a paper gown. Mm-hmm. Leave the room while they undress, because it is a violation of their privacy. And actually, it is kind of a sexual act on the part of the provider if they stay and watch the patient either dress or undress, unless that patient needs help and has asked for help. The other thing is, do not place exam tables in front of the doorway, as it may unnecessarily expose that patient to people in the hallway. Don't enter an exam room during the time of an intimate exam just to ask a question that can wait. There needs to be some sort of signaling system in place to safeguard a patient's right to privacy, like a color of, I know they have those flags on the outside. Mm-hmm, mm-hmm. So those flags should be used to say, don't come in, this is an intimate exam. Don't treat a patient as a matter of curiosity by having your medical friends come and take a look at something you may find strange or unique about their body, unless it's medically needed or they need a medical opinion. But if they have a tattoo or something, that you don't need to show it to all your medical friends. Also, never touch a patient without first getting consent. And always make sure that before you touch them, that you explain why you need to touch them and in getting that consent. Mm-hmm. Do not ambush patients. This is important with spectators, such as a student or chaperone, without first asking permission. And this should be done while the patient is making the appointment, and always should be done prior to the patient showing up or entering the room. Make it known what your policy is on the use of chaperones, because patients do have a right to say no to who sees their body or who is there. So make sure that you know the rules and make sure the patients are totally informed. Also, make sure that there are both male and female chaperones available, because it's only right that a male should not have to have a female chaperone. Mm-hmm. Do not discuss the patient in open areas where others who are not part of the care team can hear about that patient. It is not only a HIPAA violation, but morally you should not be talking about a patient. Since doctors no longer make hospital calls and there are urgent care facilities, there are really fewer reasons why appointments should be late, especially over 30 minutes late. Realize that patients have lives outside of your facility, and they have schedules to keep and important matters to tend to. Mm-hmm. Don't overbook your time slots. Remember, just because you're having a bad day and want to be elsewhere or have a personal bias, that does not entitle you to treat the patient with anything less than being polite and respectful. Mm-hmm. Remember, the patient is paying for your service. Mostly remember that you are providing a service. Patients are not children to be scolded or reprimanded or talked down to. Avoid words like you must, orders, not compliant, as they infer that you believe you are in a position of authority over the patient. You are not. While you do paperwork, don't ignore the patient by working on your computer. Listen and look at the patient while you are talking and while they are talking to you. If you are wearing gloves, don't enter the patient room wearing gloves and expect to touch that patient with gloves that have been elsewhere. That's a germ spreader. Each patient should have gloves that are put on after the medical provider has scrubbed their hands in that room. And remember, most of all, that someday you may, as the medical provider, be a patient too. Remember, how do you want to be treated as a patient? And also, are you acting in that manner? That's so important, because most of the time, everyone will be a patient at some point in time. And medical providers are patients. And I know a lot of them don't like the things that they do to others. I remember reading about a nurse who knew that unconsented for pelvic exams were being done on patients. So when she went in to have her procedure, she thought that she had all of her I's dotted and her T's crossed and she wouldn't be a victim. And then she woke up and found out that she was a victim and she felt violated. And so now she has PTSD. But all those years before, she knew that was happening.
Mm-hmm.
But when it happened to her, it was a different story.
Mm-hmm. Mm-hmm. There are some movies, some famous movies about that. I know there's one about an abortion clinic and how the woman, I don't remember the name of the movie, but how the woman changed her mind when she actually saw the abortions being performed and how, you know, horrific it was. And so I remember that. And there is also a movie, too, I don't remember the name, of the doctor who was treating his patients pretty badly and then went in as a patient and saw exactly the other side to it on how patients were being treated in his manner and whatever. And it was a rude awakening, too. So, right, you have to remember that you can be the other side. What's the famous quote, you know, take care of the people on the bottom because they're going to be there when you are on your way back down, kind of thing. I mean, I've been told that so many years. My one comment about the gowns, a lot of places don't have the capacity to have fabric gowns and wash them and launder them, all that. I mean, it may be a cop-out on my side to say that of using the paper gowns instead. I kind of get that with the paper gowns. But if you do that, don't hand somebody, and I'm being a little bit facetious, something the size of a paper towel, that's your cover up. Give them a regular gown, even if it is paper. Some of the ones want it paper because they want to rip certain sections of the gown to see better that area. I've had that happen with different doctors. So, I mean, that's my only defense for that. The other thing is just common courtesy. I mean, what you're talking about is just common courtesy that, you know, used to happen maybe a little bit more than it does now. I mean, I don't even want to put that out as an excuse or, you know, as a whatever, a factoid, however you want to call it. But we're all human beings. I mean, when you go into the medical system like that, you're scared. First of all, you're scared. I mean, I would be. Why not? I mean, unless you're in there for just getting a blood test or something. But you're in these serious situations. You're scared to begin with. You don't know what's going to happen. Everything is foreign. Right. I mean, how many people really do navigate the medical arena unless you're there so often? Because you have so many procedures and you get a little bit used to it if that's even possible, but you're afraid. You know, and everything's off-putting, and I don't get the routineness of it. And not that you have to kowtow to people. You don't have to do that at all, but there is a certain decorum. And you're right about that, Jeannie. There's totally a certain decorum. It is not big box healthcare. It isn't. You're not going to the big whatever discount store in the sky, and now you're going to get the discount healthcare because Lord knows the premiums that we pay, so we're not getting any discounts on any of this. And I'm laughing at that because it's just crazy, you know, in the couple seconds that we have left. But that's what it is. It's just common courtesy, and it is on both sides. It's on both sides. You know, I appreciate the doctors that are doing a great job, the nurses and the techs that are doing a great job. I couldn't do it. Totally couldn't do it. And it makes my procedure so much better when I have that kind of care. Stay tuned to Evergreen Media. We'll be right back.